The key message that I feel is the most important is to increase the proportion of nurses with baccalaureate degrees to 80% by the year 2020. Significant changes in our healthcare system in the United States are currently taking place. This has necessitated a profound change in the way that nurses need to prepare for continued employment in the field. Patients who are admitted to hospitals are sicker and have complex health problems that require nurses to make critical decisions to help prevent complications in their care. The Bureau of Health Professions predicts a shortage of nurses by 29% in the year of 2020. The Institute of Medicine's recommendation is that 80% of RNs be BSN prepared by 2020 to help improve patient outcomes. Nurses work in environments in which they are expected to provide excellent care, but in most cases, many have limited educational requirements to perform these duties. There has been an increased emphasis on measuring patient outcomes, such as adverse events. It will be necessary to understand how the level of education will contribute to the overall safety and quality of care. Historically, RN to BSN programs have been housed within the larger university-based baccalaureate programs. In 1909, in an attempt to move training programs out of hospitals, the University of Minnesota became the first university to offer a Bachelor of Science nursing degree. By 1922, Sigma Theta Tau, Nursing's Honor Society, was founded and set the expectation that the baccalaureate degree would be required for entrance into professional practice. However, during the World War II era, the United States saw a decline in registered nurses, and to address that shortage, nursing schools began developing a degree option. That degree option would prepare nurses in a 2-year program and is known as the associate degree. Typically, RNs who have had a diploma or associate degree in nursing have sought a bachelor's of science in nursing degree for several different reasons. 1, to qualify for a position that required a degree. 2, to go on to graduate school. Or 3, for personal fulfillment. Nursing students have been able to choose between 3 educational pathways to become RNs. This diverse educational preparation has created fragmentation within the field and has caused confusion among other healthcare professionals regarding the expectations within the clinical setting. After many decades, the BSN is becoming the primary entrance into the nursing profession. The American Association of Colleges of Nursing, the American Organization of Nurse Executives, and the American Nurse Association are all recognizing the BSN as the minimum educational requirement for professional practice. The BSN is linked to better outcomes. 39.1% of employees prefer to hire only BSN graduates. 77.4% strongly prefer to hire only BSN graduates. Hospitals are using data to compare themselves with other hospitals to determine the quality of care that is provided. The National Database of Nursing Quality Indicators includes patients' falls, healthcare-associated infections such as blood and catheter infections, restraint prevalence, and pressure ulcer prevalence to identify where quality improvement plans should be initiated. This index also measures characteristics of the nursing workforce that have been related to the quality of patient care, such as turnover, staffing levels, and RN education and certification. The next slide shows some of the barriers to continuing your education. I found this little cartoon of a child that was trick-or-treating, and she's asking for money instead of candy to help pay for her nursing school education. Thought that was kind of cute. So I wanted to talk about some of the barriers. Several barriers, including time, finances, and family and personal issues, were cited as very significant challenges for RN to BSN students. Other barriers included computer literacy and writing abilities, and these became more obvious as the student progressed in their studies. Students had multiple outside commitments such as elder care, child care, and work that could interfere with their commitment to continue their education. Students who were not committed and ready for the rigor of a BSN program could end up falling out or even giving up. According to the study, there seemed to be, according to one of the studies that I chose to look at, there seemed to be a lack of financial support for RNs to return to school to obtain their BSN and a corresponding lack of financial incentive as well. So there is a definite trend among RNs seeking their BSN earlier in their career. There's another concerning issue if there's progress toward the goal of 80% by 2020. The number of RN to BSN programs and the number of graduates must grow by much greater numbers than the current capacity allows. So some of the solutions to this is to expand loans and grants, have loan forgiveness, increase scholarships, increase qualified faculty, increase education for web-based instruction, work together to pool funds from public and private sectors, expand the baccalaureate program, increase the classes online, provide dedicated advisement for students, and offer more information on loans and scholarships. These were some of the things cited by students as being important and also by educators as being important to actually reach the goal of 80%. So in conclusion, I realized as I was writing this paper that I would actually help to contribute to the goal of 80% by 2020. And I also know all of you will too, because all of you are enrolled in this BSN program. So my question, what recommendations do you have that would make it easier for you to obtain your BSN degree? Thank you so much.